And you are now live.
This is Senate Appropriations. We're continuing our work and our walkthrough on the web report of the budget as passed by the House. We left off at section B 300, which is human services. I anticipate that there'll be a number of sections that will remain open for further discussion. So we're going to, do you all have the web report pulled up?
Yeah.
And if you click on that human service link, it'll bring you right to section B300.
Jane?
Yes.
I'm looking on the budget assignments.
Uh-huh.
Yours says Human Services Board.
Yes.
Is the Human Services chunk of the budget yours, or is that someone else?
No, there's a Human Services Board. It hears appeals on any decisions made by benefits or services by the agency. So it's an appeal. In other words, if I had my food stamp application denied, I feel that was an error that can be appealed. So it's the appeals board.
I'm just wondering who has Human Services.
Well, it's divvied up. It's half of state government. So the Human Services Board is one piece, the agency secretary's office. For example, Dick has got Department of Corrections. Rich has got Dale and part of DCF. I've got DEVA. So that agency is assigned to multiple members of this committee, depending on the department and the function. So the Human Services Board, which is an appellate, and to hear grievances around decisions made under agency programs, is just part of that. One of the budget components of this agency. But no one has the entire agency of Human Services as their assignment. Underneath it, their department-specific assignments.
Okay, great. Thank you.
Okay. So the first one is the Secretary's office. And we can start there. And as you can see, the House made no changes. And then where there was changes would be 301. And this will be where we'll have more discussion, because anything to do with Medicaid is going to show up in two places, one of which is the global commitment, which gets appropriated there, and then subsequently global commitment is then appropriated to the individual departments. So, for example, an increase for example, the AFSCME contract would appear in the Dale budget, and so I'm just saying you'll see, because of the global commitment, you see it twice. One is sort of the agency level where it brings in under the waiver all the funding, and then it's reappropriated out to individual programs and departments. So any change that we make to a Medicaid program, like changing the appropriation, the House is proposing a 2% increase. We hope that maybe we can look at how that, who's included in that increase, the extent to which it could be made a bit more, if we could do that. And that would change the global commitment, would have to be changed. So I'm going to just suggest we leave that alone, knowing that it's going to be, it's just like the end of the well, whatever you call it there. The totals for different sections of the budget, like the 200 sections, there was a total there, and that could change depending on what is above it. The same thing is going to be true with the global commitment. So I'm going to suggest we not spend a lot of time on global commitment, because that is in the end where any changes that we make, increases or adjustments, will ultimately have to be reflected. So it's not, it's very much subject to change to future discussions and decisions of the committee. So so that's there's a lot of moving pieces there because Medicaid funding is appropriated out to a variety of departments. So have I made everything clear on that?
If I do an increase, a 2% increase in Dale for some of the community agencies, it's going to be those first two numbers are going to change.
Yeah, if you could say, gee, we could scrape together enough to do 2.2, then every number, it's going to change. So I'm going to suggect.
Madam Chair, your job is to scrape together the money. Mine is to recommend to you higher.
Where the hell did that come from?
I didn't know that was part of my job description. So let's move on to Disabilities Council. The House made no changes. I'm in section 303. You can see it's very modest change, and it's really on the personal services where we see the change, and I would suggest we close that out. The Human Services Board, we've already talked about that. They hear the appeals. You denied my application for this benefit. I disagree. And then appeals, then the Human Services Board, their hearing officers, there's a board. They make a decision to either affirm or reverse the agency decision, and the next step would be an appeal to the Vermont Supreme Court. So it's the board that hears the first step of those grievances.
I want to just, if I might.
Yes. Do you want to close out 304?
I'm fine with closing it out, but I want to put on our radar screens that they've been asking for help for a long time, and maybe asking our Health and Welfare Committee to look at the role of the Human Services Board and how they can,
I know they've been hearing things. They're now getting into appeals on the abuse, neglect on the registry,
right.
Child abuse registry.
Yep.
And that's
they're just only know because Charlie Jingo's the chair and he's from Bennington, or was the chair. But over the years, and I don't think any of us have paid much attention to this board, but they've got a lot of responsibility, and
They do.
I think maybe we should ask, just to report back or ask help somehow.
They provide data to us, and we ought to ask for that.
I think that they get kind of, the secretary isn't really, not you, Madam Chair, but some of the secretaries haven't been exactly fond of the Human Services Board.
Well, this would be for the staff, staffing of it.
Yeah, I know they asked for an investigator a while back. More
investigator?
Yeah.
Okay.
I just would like to at least take a look at them. Somebody look at this.
Well, perhaps we could write a letter to the secretary and ask if, I know they provide a report, because I get it, on the number of cases and so forth. Do you know who the chair of the board is?
I don't right now.
At this point, it's not Charlie, obviously. It used to be Kent Stoneman, I think, many years ago.
Yeah.
John Nutting, I think, that's really ancient history.
Yeah, we're going way back.
Yeah. Let's put a note on that and see if we can get a better understanding. We'll leave this for now, but I do think that
I'm fine with closing out the money. I just would like to have,
okay,
as their duties expand and as we expect more and more,
well, certainly I know the appeals on whether, your name should be removed from the registry and stuff.
Right.
Those can be pretty complicated cases.
Yeah.
And they've been a big thing for quite a while because of employment, if your name is on that registry.
Yeah.
That's right. Okay, well, we'll leave the money the way it is, but I think it means we've got to really understand how that workload has perhaps altered and grown over, say, the last 5 to 10 years. Administrative AHS, that's just a standard amount that we put in to deal with administrative costs, and that's remaining the same. And I would recommend this. The only reason I'm recommending it's my section of the budget that we leave that the way it is. Now we're down to administration, and that was DEVA and the House. I know that they're having to absorb in some position reductions, and but I would recommend that we close out the administration of DEVA. I remember when this used to be the Medicaid division, and I think it was under 50 people. So, and we really have got a huge growth in the role of the state in healthcare administration, and you can see that in DEVA in the administration, which includes a very expensive. They do all the reimbursements for Medicaid claims for other departments. They do a lot of the rate set. I don't even need to bring that up. You didn't hear me, Senator Sears. So I'm going to close that out. Global commitment. This, I think we want to keep this open to see what we might be able to do. This is $1 a day increase on the ACCS rate. That's our community care systems. They provide care for people whose level of care is not at a nursing home level, but they are many of our residential care facilities are very, very stretched financially, as we know. If you've got any in your district, you may have heard from them. Bobby Craftsbury, for example, is
we gave them a very small increase over the last 2 years.
Yeah,
well, I'm saying let's hold 307 out to see if there's the House recognized the plight and was able to find $1 a day increase. And we may be able to do a bit more. I don't know, but I don't want to close it out and just say that's the best we can do.
Does this include the visiting nurses and that group?
No.
This would be your residential care.
Oh, okay. I know they're looking for a rate increase too.
Yeah, there's a choices for care
Right.
component, and that would be in Dale. And that,
All right, when we get there.
yeah, I think that was the 2% for them as well.
Yep.
We did try to move these res care pieces into Dale a couple of years ago, and part of the reason they get left behind, those res care facilities, is because all of the services they offer are more related to Dale. And did we get that? Did we accomplish that?
I don't know. I remember I said, look, if we're moving the nursing home budget, we should be moving that as well, because it's been kind of left out there stranded, and no one is really
There's
paid
been
attention.
Nobody to pay attention.
Stephanie, remember that language? I put it in, what was it, last year when we moved the nursing home?
No, it would have been a couple of years ago.
It was,
I think we did, I think 2 years ago when we did a bigger bump to the res care and for the residents. And so, and the actual licensing, I think, is in Dale. It's just that this is a budgetary artifact, remains in DEVA. And I'll review why it's hard to move the budget piece out.
Yeah, and there's such a little piece of DEVA that nobody ever pays attention to them.
Well, we paid attention to it a couple of years ago, and I remember we put language in saying that we would transfer the nursing home appropriation, and we wanted them to look at the other parts of the long-term care system. And so we don't need to do it right now, but we should go back and check the language as to what we asked them to do. Because I think the concern then is the same as it is now. It's just kind of in between departments, and it needs to be looked at as part of that long-term care.
2 years ago when we did this, I think they hadn't had an increase in 9 years. I think that was right.
It was
Well,
something,
Yeah, it was a long, yeah. So we're going to keep that open for now. The Medicaid state only. Oh, don't ask me. This is mainly clawback, and I'm not recommending any change on that. What else? Dish, I guess. Dish is that?
Dish is in the non-waiver.
Yeah, and CHIP is in the non-waiver.
Yeah.
So mostly it's clawback.
It's clawback, and it's
And
the
pharmacy.
portion of the cost sharing assistance that's 100% state
Yeah.
funded, as opposed to the premium assistance, which is matched for the folks up to 300%.
So when we did the market move to the federal healthcare reform, Obamacare, actually people were better. They had better benefits under Catamount. So we ended up doing two things, one of which was the premium, helping on the premium cost, as well as cost sharing. So the cost sharing, it's always hard to remember which was Medicaid matched and which is not, but the cost sharing is not matched.
Right.
So that's what's reflected here, as well as the clawback, which is the Part D pharmacy benefit to Medicare, which
That goes back 15 years. Yeah.
and so we have to pay them back. And then the Medicaid non-waiver match, that's SCHIP and Dish.
And Dish. Yep.
And so I'm not recommending any changes there. We can close that out. Administration and support in the health department. Rich, that's getting into your section.
Yes. I'll need to come back to that, Jane.
What the House was doing is funding with this $2.2 million, the Act 155 that you passed last year on primary care.
Yep.
And there's language in the bill as well around the structure of there's some amendments to the underlying bill in this budget bill on those pieces and how it flows through VSAC, and a required memorandum of understanding between AHEC and VSAC.
So where are they getting the state match on the global commitment?
So you'll see it. You would have seen it up in the last two items.
How's the federal funds? Where they're so this is so my question is, what is the federal fund source?
The federal fund is just regular Medicaid match, and they put $1 million. They did it only in one-time general fund, so you actually don't see the $1 million here. You'll see the $1 million of state match in the one-time list because they're doing it for just this chunk of money until it's.
Okay. All right. Well, when we passed the bill, we had a work committee to see if there were ways that we could take money that was going for health-related education and that was not matched. And we got a report back that basically gave us no help at all. Nobody could identify anything that they could make available to match. So this is just plugging the hole for another year. I'm hoping that we could identify money that is going out for nursing scholarships or other through the colleges, because we do scholarships through UVM, et cetera, that might be available to be matched against Medicaid on an ongoing basis. And if you remember, this was a bill that came to us very late in the session, and we created a work group to identify, and we took on a one-time basis money from the Vermont training program that was unobligated to fund the first year, but it was with the idea that the work committee could identify existing general funds that were appropriated for educational, for tuition or educational assistance that could be specifically made available to be matched. And the report back that we got was they couldn't come up with anything. Maybe I'm not fair in my assessment, Stephanie, but you saw the report.
Yeah.
So this is begging a bit more time to see if there's still some potential there. I think that there is, but nobody wanted to identify anything in their area to be made available for this purpose. So this is using one-time general fund off the 211 million available.
Yeah, so it's actually 2 million that they put aside. It's for 2 years. So $1 million this year to match for 22 to provide 2.2 million of scholarships. And then another $1 million, the $1 million would carry forward into 23 and be available again. And then you'd be, as you go into 24, trying to figure out if you were continuing this and how you fund it.
Okay. All right.
Leave that.
Do you want to use the general fund in that way? To
I think we should.
And you may be, when you go through the general fund one-time list, you may be revisiting it. And if you do change something, it would just have a feedback loop to this section.
So it is basically saying we've got some general fund available.
Yeah.
This is a critical workforce issue, certainly. Yep. Primary, getting primary care providers as well as nurses. So I think, unless I see a reading, people are sympathetic. We've got this program up. It's a recognized need. It's really important to healthcare delivery. And so we'll revisit this again when we're looking at one-time general fund uses, but at least conceptually, people would like to keep this program funded for the next 2 years.
Good.
Yep.
Okay. All right, let's move along to public health.
And this, we've had those requests for the tobacco programs.
Oh.
Well, there's no, that was out of ARPA, so we're putting those on the request. And if we did it, I'm not sure that I would, Stephanie, can we could appropriate that as one-time money in a different section.
Yes, yeah.
So we could leave this base appropriation intact. And if we decide we wanted to put more money.
It still brings up that question. We still are doing terrible with the pregnant moms.
And we have done, we've actually done terrible for the last 20 years. We have not, right. We have the undistinguished honor, I think, of being the worst state in the nation for the percentage of pregnant women who smoke. And we never, obviously, Senator Westman and I have been out here saying this is really something that we should tackle. It should be a priority. We obviously have a lot of focus on youth smoking. And you can remember we asked the commissioner about this. And there was some discussion, well, if you start smoking as a youth, then you might smoke as, as a pregnant adult. But there might, the fact that other states are doing better in a critical area where we know it contributes to low birth rates and other adverse effects on the unborn, as well as bringing a child into an environment where there's secondhand smoke, there's obvious reasons for being very troubled that we have not made any progress in this particular area for years. So I know that that request is there. We'll just have to look at it as part of all those requests we've received for one-time funding.
And
So
then,
do you want to close out the?
I would.
Okay.
And in the alcohol and drug abuse sections, we've had the requests from recovery centers.
Yes, and one of the things that the House was hoping, because we had 240 and 315, and they had, which was 20,000, and they had 300,000, and so the hope is that we would be able to put the two together and using ARPA, which would be on the one-time list, not
Right
here.
Yeah,
and that is to be able to get.
These numbers are fine, but when we get to the ARPA sections, I think the recovery centers could use help.
Mm-hmm. Okay, so now we're down to mental health, and the House made some changes here, and this gets into the 2% rate, and we're going to kind of set those aside to see what we might be able to do if in fact we could increase that a bit. So I'm recommending that B314 be kept open pending more discussion about what is possible. Just to remind people, the governor's proposed budget had no increase, which is in essence asking agencies, which frankly, the workforce is larger than the state workforce, to absorb any operating costs and salary costs with no money, which means de facto they're having to, they're funding it by high vacancy rates, deferring capital improvement, and so forth. So the House recognized a 2%, and I think we would, unless I hear differently, would keep that open pending further discussion and what we might, if in fact we could do something a bit more.
Do you want to talk about the other two items that they did here?
Sure.
So they added to the base just shy of $300,000 of general fund for the warm line funding increase. And then they took out what was an ad from the governor of $600,000 of general fund for the mobile crisis unit, which is in Rutland. And they funded that mobile crisis unit for 2 years out of ARPA funds when you get to the ARPA one-time list.
Okay.
So that, you know, depending on the nature of the mobile crisis unit, there is a 3-year FMAP of 85% in the ARPA bill for mobile crisis services. And so that may move out of ARPA state fiscal relief back into Medicaid with a very small match if the nature of what this mobile crisis unit is matches up with.
Okay. I'm going to keep them all open. I don't know the amount on the warm lines, if we're actually expanding or whether it's more than 2% that the rest of the system is getting. And so I want to look at it as a package.
Okay.
All right. Now we're back to DCF.
So I'm really not ready with DCF to do anything.
You're not?
Not till next week.
All right. What about administration?
I would rather not do any of it until next week.
Okay. Right.
I can talk my way through Dale.
All right, so we'll just hold that.
Yep.
What about the Office of Child Support? We could probably close that out.
No,
Yes, you
yeah,
can
well, I
close
can
that.
do the family services, by the way.
We have, oh, wait a minute. B317. Okay.
Yeah.
All right. Yes, Dick.
Yeah, I mean, the only place there is we're still jumping off that ledge over Beckett. and knows.
Yeah.
They put in, I don't think we're gonna change that. They put in 1.3 million to make residential. If they don't get it, it's gonna make everything much more difficult. If they don't have Beckett by 10.
Although obviously they're funding alternative placements right now.
Yeah, but they're relying on Beckett to a great extent to have that work.
All right, well, obviously that's still in a decision yet to be made, so.
Yep.
But, so 317 as it has been recommended, you would
Yep.
agree that.
I
we
would
close
agree
it?
that we're fine with the House
Okay,
doing nothing to the governor's recommend.
okay, all right,
That one's closed.
all right. Didn't mean to skip over you, Dick, on that one.
No, it's all right.
The child development, it's going to be open. Child support, I would think that's pretty straightforward.
Yep, that
I'll
is.
close that. This B320 is the AABD. It's the state supplement to the SSI benefit.
And that's fine.
I would point out that we haven't increased that. We used to do that every year and we haven't done it for years. It's once again one of those areas that's remained very stagnant. But with that just comment, we'll close it out. General assistance is
So this is that whole issue of doing away with GA and moving services to
Community.
OEO.
And so what they're undoing that here in the House. They're moving the
Yep.
money back into GA for the time being until there's a plan.
Yeah, but that's what, yeah. The administration wanted to move to the community action agencies. What I will say to you is that I'm not sure the community action agencies are ready to do this. I think that from their position, yeah, they make a pretty good case about, so.
I've gotten the same feedback that this is not the time. They feel that in some ways it's a conflict of role to be trying to serve families as well as being the arbiter or the decider about these benefits. We also know that it has been a real challenge in terms of addressing the need, but I think they're feeling that the resources of the state are perhaps better, where the state is better equipped to deal with that unknown in the demands than community action or community-based organizations.
I would, but I would also say, I think that they make, DCF makes a pretty good case that if we're ever going to get a handle on motel rooms and that whole system, that you do need people that are closer to the community, and the community action agencies are closer to their communities than running a statewide program.
I think conceptually, most people would agree. The problem is one of the fact that we have a housing shortage, and the reliance on motels is symptomatic of the lack of resources that exist to prevent that. So if you've got a choice of keeping a family in a car and it's 20 below, or a motel room, the choice has been you put a roof over their head. So and that ties into some of the concern too, and that is, well, isn't this really shifting a problem that is the state is finding it difficult to manage out to a community-based organization when the realities of the resources and the availability of housing have yet to be addressed? That's
I-
kind of the feedback, in all honesty, that
Well,
I've gotten.
I get that feedback, but we've had somewhat of a reprieve with COVID because we've been able to use federal funds to run a program in the motel rooms.
And we're probably
We're
going to
not
have to
gonna
do
have
that
that
even
for-
more for a
What?
little longer.
Well, we're going to be able to do that a little longer, but we aren't going to be able to do that forever. And we aren't going to be able to afford the level of motel rooms that we've been able to afford over the last year.
Well-
So, so it does bring up the question of they put out an idea to move us to a better place and get to a place, and we have reasonable coverage. We don't have wonderful coverage in shelters around the state. So I just, I don't think this is ready to go prime right now, but I do have to say, I don't think where we are is where ultimately we can afford to be.
Well, I'm back when GA was moved from the towns to the state. And so I know that I'm aging myself, but
No, I get.
And so the other concern is when it's a statewide program, then you have consistency of rules, you have the appeals process, you have a lot of protections that are built in that don't necessarily are not there under a more distributive, community-based approach.
Yes,
and so
you are making the Vermont legal aid argument that we heard in testimony, and when you say that, and I understand that.
Well,
But
I'm just relating back to the disparate responses families got depending on what region they were in. Even setting aside the appeals part.
I'm not questioning that, but what I am saying is, what are we going to do when there isn't all the federal money to do the motel rooms?
Well,
And we can't afford the level that we've had.
I think that's true. And that's why one of the things we're going to have to look at, and I see Senator Sears' hand is up, is what in fact, and we're going to need some more testimony, is in the recommendation of housing, which has a large amount, a very significant amount of money to be moved out to bring 600 units online. And so that is a major, if in fact we feel comfortable, and that is a good use of money to start making some progress on it. We need to have that conversation too, because it's a major investment of resources, and it's in the vicinity of 90 million, I think was $90 million. So I think we will be looking at understanding what's in that package, how it will address the current situation, which has been a public health response to house everyone, and what that looks like relative to what the housing people in ACCD, OEO, and VHCB and others feel is doable. So it's a huge challenge. COVID has really brought it out to the forefront. We've had so much in the way of federal resources. We've been able to house people in a way that as a state we could never do. And it's sort of like, what is that plan? And which is going to have to occur over very short term, when motels and hotels are going to say, we want the rooms back for our tourist rate. And then the longer term. So Senator Sears.
Well, I just was referring, actually, you raised some of that, but the email I got from the administration indicates 249 million over FY 22, 23, and 24 to create 5,000 new units of housing, 600 units of rapid permanent housing for homeless, and that's 90 million. And then increased shelter capacity is 12 million. That's this fiscal.
And those are decisions that we're going to be making in the use
Right,
of
but I
ARPA
think,
money.
yeah, no, I know, he or she, whoever made this. Mine came to all the Bennington area delegation because they would use 23.4 million for the Putnam Community Health Mixed Use Development for housing there. Of course, they've got all kinds of other things. I don't know. Did you get this same thing?
Believe it or not, every legislator got how the governor's proposal would.
Yeah, I'm sure you're for the Peacham project and the Greensboro and the two St. Johnsbury projects.
The one thing that I find troubling is it could potentially create the impression that that money is approved and it's going to go on its way. Those are,
well, yeah.
First of all, what?
Well, of course it does.
Well,
I mean, that's why I got calls or messages from House members.
That's part of the reason I don't think this is ready to go. But for me just to shut the door on any movement in this direction is hard.
Well, we have other language about creating a work group. And so I think we have to look at that because this is something that is not going to be solved between now and say May 10th when we adjourn. We've got to really figure out how or have comfortable that that there is sort of a plan ahead. But the amount of money that ARPA is putting here gives us resources to make some substantial progress in an area where I would hate to say it, as much as we don't like the motels, it is symptomatic of the fact that we don't have adequate housing and emergency housing alternatives. So, and I would say to you, I'm not, it's not, this isn't a matter of not liking the hotels. When everything opens back up, we aren't going to have the hotels.
And just
I know that's our short-term challenge, Alice, and then
just on behalf of some of the hotels. I mean, the Rutland situation, the Quality Inn, where there have been 2 murders, they're very anxious to get out of the homeless business.
Yeah. I don't want to go to the Rutland Quality Inn.
They just had
I mean, that's a great advertisement for your inn. There's been 2 murders there.
I think the what this discussion also points out, it's not just a matter of the physical housing, but the extent to which there is oversight and there's supportive services that go with these individuals and families, so that those kinds of incidents are really either minimized or avoided. But we know from earlier testimony that you can put a family into an apartment, but many of them need to have that ongoing support and oversight and monitoring, and the landlord needs to have assurances that there is someone there to call if there's difficulty. So it's not just a matter of paying the rent, it is really preserving the rent. And I don't know the extent to which we can look at, and Stephanie, in the money that we got, and I raised this, I think yesterday, that 200 million for rental assistance, a big slug of money went to AHS for support. And do we have any guidance as to the extent to which those funds can go with the actual payment of the rent, so that families, once they get into housing, can stay in that housing?
So on what we understand about the rental assistance money is we can use it to pay the rental piece, to the extent we're extending hotel stays, that's the hotel bill. We can't use it for the necessarily the wraparound service piece unless it's within that percentage under the rental assistance. And so what the House did is they set aside a $40 million chunk of the rental assistance to get us through 22. and 10 million of the ARPA for the service piece. So that's in terms of just 22 and how we cover transition. And that was an estimate, assuming, if nothing changed and we maintained where we are at, and this doesn't include the continuing growth month to month that we're having in the emergency housing, we would be up at around $109 million is the projection for total spend for a year for 22.
Well, that's all on the one time.
That's all in the one time. Yep.
Okay. All right.
The whole point you make about wraparound services is part of what DCF says about the real problem with hotels and motels, that the reason they want to move it to community service, or their counselors go with the housing that they get in the shelter housing. So it's all better connected.
Well, GA doesn't pay for those support services. So
no, and you're separated from that counseling when you're just put into a hotel or motel, and you have been somewhat separated from that moving in and out of a shelter now. This is an attempt to try to bring some of that together.
I'm not debating the merits of it. I'm just wondering whether what it will take to do it, the cost, the fact that you're putting a very significant duty. I would imagine the administrative costs to provide those wraparound services, et cetera, that has never been recognized in the GA budget.
And I'm not sure across the state in communities like Rutland that they're totally ready for this. But
all right. Well, I think we probably should. I think, unless I'm reading people wrong, we're not about to give community organizations programs or responsibility that they're saying they cannot and not willing to accept.
Yeah.
That a lot more work and planning has to go into it before not that the concept is flawed or the goal, but that the timing right now.
We're holding B325 open, is that correct?
Well,
still at 320.
We're on general assistance, 321.
Yeah,
I'm sorry. Well, 325 is the same.
So.
Yes, because they were moving it from GA to OEO, Dick.
Yeah.
Right.
Yeah. So what we've done is basically backed it out of OEO and kept it as a GA, and we're keeping the current arrangement in place.
I would rather you give me a chance to go back to DCF and say, you're not going to get all of this this year. Is there and express those concerns and see what I get for a reaction.
Well, we had a preliminary discussion with the secretary on that, and that was what ended up with the language on the housing work group. So you want to take a look at that. And because it was acknowledgement that this wasn't going to work right now. And so they recommended some language that the House made some adjustments to, which is in the language section of the bill. And that the first cut came from the Agency of Human Services, recognizing that this proposal was not ready for action at this point. So what we have here is the interplay between GA and OEO, and it's backing out this proposal to move the GA emergency housing piece out to the communities. So that's what's happening here. And this was written before the ARPA money and all.
It was all done before the ARPA. Yep.
So I think what we're saying is that between the two, we don't want to move it to OEO and we want to keep it in GA. And basically our meeting that we had in terms of where things stand was such that what the House did is reflective of sort of where the agency was at the time they were working on their budget. So they had moved away from this original proposal.
Yeah, I understand that, but it doesn't mean that in a year from now, when I don't have any motel rooms, if we can take steps to
you may not have a
create those
motel room,
links.
Senator Westman, but you probably do have a big bread and B&B or Airbnb.
Yeah,
you?
I
have but I'm in the same position a lot of those hotel rooms are. When I get a good paying customer, I'm going to take it.
Well, now you understand the dynamics at work.
I can't afford to go cheap with my mortgage.
Let's keep going. At least I think the agency is not recommending the move at this time. That's my last understanding. The House put in some language around the study committee to really consider going. We need to come back, but I need to have a reading. We're not going to force an organizational change that no one wants or supports at this point.
No.
Okay. All right. So let's move on then to 3 squares. That's just the cash out portion of food stamps.
That's fine.
Reach up.
We ought to do more here.
We want to keep that open. Just to remind people, we did a modest increase. This is the program that provides financial assistance to families whose either some of them, in fact, the parents are unable to work. There might be SSI beneficiaries, or they're recently separated, or single parent families. We currently are paying about a family, and this is why we want to see what we can do if there's a possibility. What is happening is all the savings, because of the reduction in the caseload, are being used in other places of the budget. In the past, many years ago, we kind of anticipated savings and allocated them to the SSI related portion of the Reach Up program. But the benefits right now are about $740 a month for a mother, say a single mother with 2 kids, to feed, clothe, and pay rent. So when people talk about hungry children and talk about abject poverty, we're talking about families that are Reach Up dependent. Those benefits used to be, many years ago, relatively speaking, much more generous and provided a reasonable way of supporting families. That has declined over the years, and it's an example of the block grant approach in Washington. That came in with welfare reform back in the mid-90s. I think the block grant was 47 million then, and it's still 47 million. And so what happens is over time, in order to do a benefit, it all falls on the state side, simply because there's no match anymore. It used to be the old 4A program where there was a match, just like there is in Medicaid. So that's why most states are so leery about block grants, because the history on block grants is that they don't change. So Senator Westman and I have talked, and once again, we'd like to keep that open to see if, in fact, as much talk as we've had about poor children, certainly the Ag Committee and the Education Committee, but we're talking about the poorest children in the state when we're talking about these families.
If we took all of the general fund here, we could almost do Bobby's school breakfast and lunch program.
Yeah, but that doesn't do anything for these kids.
Well,
because they're already getting free meals.
I mean, well, these are only poor kids. I'm being a little,
Yeah, there are kids that are really, these are the kids that they give them backpacks on Friday afternoon so they can eat over the weekend.
I know.
That's the sad commentary on this.
Bobby,
So
would you talk to Richie, please?
He's talking, but he's mute.
I shut it off. The phone rings right off the wall here and Anita's gone. You want me to talk to Richie? Richie,
Yeah.
I need to see you in the ag room. Jane, how much is the reach up payment for 3?
$740 a month, thereabouts.
They must get more than that, though. Rent.
Well, if you're lucky enough, you will have a Section 8, but not everybody does. And so some of the families are paying most of that, and that's why they're relying on food shelves, and they do get fuel assistance. So there are other benefits flowing, but even when you add it up, it doesn't, it's hard to buy the clothes.
No, that's not too good.
No,
Yeah.
that's part of the reason when we're talking about the concern about poverty and the impact on kids. This is the basic safety net program that over the years has, and Senator Sears, you'll remember this. It used to be we would come up every year and there would be an increase, a cost of living to fund the benefits at the standard of
There was
need.
always a COLA.
Yeah, and it's
I mean, I'm seeing things that show what even in 2000, the inflationary factors of what a dollar was back in 2000, what it's worth today.
And so I realize my comments are somewhat tempered by the fact that I had, like Alice, I started out as a state lady. So when people are talking about
To say street lady?
state lady,
State.
state lady.
Welfare.
And let me tell you, all the work was done we went to homes. Nothing was done in the offices. We were in the homes. We saw what the conditions were. We helped the families. We were in schools. We were all over the place. It was a very different approach. And the common, when you knocked on the door and a kid was there, it was, Mom, the state lady's here. It didn't matter if you were male or not, you were the state lady.
Right. In my very first job, I was in houses of prostitution for who lived in those homes with their children.
Yeah.
It's like,
but a lot's been lost. It used to be probation and parole would meet at people's houses.
Yeah.
A lot's been lost in not doing that. And it used to be that there were cops on the beat. And I think that, there's a lot to be said. You remember years ago when DCF, that was SRS at the time, hired those people to be on the streets, with kids. So I can't think of what they call
street
them.
checkers?
In the street work.
Street checkers, right?
Mhm.
Street checkers or something like that.
Yeah.
There's a lot to be said for going to where the people are rather than having the people come to your, stale office.
Mm-hmm.
You learn a lot about being in someone's kitchen.
Yeah, I mean, look at Jane now. She's still supporting getting these people more money.
Well,
If she had been in an office somewhere, she probably wouldn't have seen the same level of despair, level of,
no, you would absolutely have no clue. And
I remember I used to go to kids' houses to meet with their parents, so I understood where they were coming from.
Yeah.
Thanks so
but
much.
let's face it, there's a tendency. We had that big debate, remember, about reach up workers going into homes, and now people are saying they don't want to go into people's homes because they're afraid of the risk. But those kids are in those homes day in and day out. So I'm gonna
We're
hopefully
gonna hold that one open.
we're gonna hold that one open. So and maybe you can understand a little bit when I'm talking about hungry kids, why I'm saying where our hungry kids are, and as a matter of policy and state resources, why this is so troubling. So let's keep going. LIHEAP, that's pretty, we can close that
Yeah,
out.
close
Rich.
that.
OEO, we're just backing out the proposed change. That's not, we've agreed is not the time to do it right now, but there's a lot of work that still needs to be done, and we'll look at that work group and the housing investment.
I'm going to circle back around and talk to DCF again.
Okay. Weatherization, that's the program that assists families that are it's tied to LIHEAP eligibility that qualify for home weatherization services.
Yeah,
it's been the one that's been in place for a long time.
But it's 80% of the median.
I
Is
see.
the line. So the increased amount that it is recommended from in 109 that came from natural resources. Would that show up here, or would that be on the one-time list?
That was the one time.
Yeah, so it was one time in the governor's recommend from general fund, but in the House passed version, it's one time in ARPA funds, and the governor looks like he moved it to ARPA funds in his proposal. So
he did move it to that, and natural resources will have a recommendation next week for our committee around that.
About the one time or the ARPA funding?
About the whole weatherization package that they sent over in S109. But in that, but the whole thing. But in that, there is 4 million that goes to OEO to be distributed to the cap agencies to do that work.
So I know that there was been some concern about fracturing the funding streams for OEO. We got a memo from Sean Brown about that. Why would this money? So are you talking about moving any of this $12 million appropriation, or
No,
just the additional money?
It's just the additional money that
okay,
we're
so you can,
about.
all right, so this can be closed out here.
Yeah, this can be
okay.
closed out. I just wanted to mention that in relationship that if when we get to those next pieces, there's going to be you're going to see 4 million there for OEO.
Okay, all right. Dick, is this really the comment section you were talking about, 327?
Well, that, yes, I did the other family services, but this is just the secure, this is just the Beckett. What was Woodside was 6.5 million. It's down to 4.3.
Okay. Assuming that program
assuming that, yeah, and
What's the latest?
well,
they're still waiting for the neighbors, as far as I know.
They have I think that it has to be, it's got to be reviewed by the local review board. It's Beckett property. It's not owned by the state. So the proposal from Beckett is around their program to be cited at property that they own. Needless to say, that's raised questions and concerns by adjacent property owners and other people in town as to having any facility in their town. So that permit process is still underway with the town of Newbury.
There's no question that this is putting tremendous stress on the current system.
Not having a facility?
Not having a facility is putting tremendous stress on the system.
Yeah.
I think that the administration would prefer to deny that, but I do think there's plenty of evidence that it's putting a stress on the system.
Yeah.
So hopefully this will come through, but it's going to take longer than I think we originally anticipated.
Well, I know that.
Because once it's approved, if it's approved,
Yeah.
then you still got a long time to get the construction done and get everything done right. And then you've got Vermont Disability Rights complaining about some of the plans,
Yeah.
and you've got VCF. That's the.
There's another group out there too from the Vermont Law School that's been carrying on too. And
Oh, really? I wasn't aware of that.
it's
Isn't that more about Beckett services in general?
yes. Yeah, it's about Beckett services in general and overall DCS placing children in residential placements.
So what are they gonna do? Move those children to New Hampshire and let the money go there?
Well, I think that the policy committees have felt that there needed to be a Vermont-based facility to provide the necessary oversight and treatment for Vermont children.
Yeah, but we don't want jobs and people that are gonna, causing grief.
Well, I think it's a small town, Bobby, and they have legitimate concerns
Yeah.
about public safety. And Bennington right now is got two programs, one for the girls, one for the boys, that is somewhat replacing what was at Woodside.
So
and then you have Turtle Rock's in Montpelier, I think.
Yeah, right. I thought that got closed down. Did that get closed?
Well, that would be news to me, because the last time I
maybe-
talked to the commissioner, he was
No. What did we have for Turtle Rock? We had some discussion around that.
Isn't it part of Washington County Mental?
yeah.
Yeah,
I
it
think
is.
so, yeah. I don't think it's been closed, Jane.
No, I guess not. I was.
I think you had a funding piece in the budget adjustment related to it.
I guess that
Yeah,
was it.
yeah,
Okay.
yeah.
I knew we had something.
So, it's putting extra pressure on the system. And also goes back to our sheriff's conversation, where, they can't get transports to go to Bennington or, I think Newbury, that is an issue, though. It's a small
Yeah.
But
community.
Newberry or Bradford?
No, it's Newbury. Bradford has
Newbury.
got Valley Vista, which is the residential drug treatment facility, which got cited many years ago, and it was a nursing home facility that was being shut down because of the census going down, and that was except for that unfortunate example of someone who, remember, got released from jail or whatever
Yeah,
and left the
yeah.
facility. But that's been fairly uneventful. The other reality is, though, we have a lot of very small facilities, particularly those that are under the auspices of mental health, where you've got your 248 population. Or people who are not can be adjudicated because of a significant mental health issue. And so we do have a number of very small and very secure facilities that are in many towns around the state. I think Dick has indicated a couple for juveniles are in Bennington, but up in our area, Bobby, and the Northeast Kingdom, there are a number of these very small, very secure facilities to deal with individuals who are sort of associated with the criminal justice system, but can't be adjudicated either because of intellectual disability or a mental illness. So let's see, where are we now? We're on DD.
We're on 327.
Well, I thought we had closed that out.
Yeah, we just did, right?
Okay, 328, disability determination, that's mostly federal. That's for Social Security, but it also for SSI, and they do Medicaid disability. Close that out.
Yeah, going back to 327, I'll point out that it's mostly now general fund. And it was, it's grants, global commitments, only 37. The general fund is 4.3 million. and on the secure residential treatment. And if you remember, there was a lot of discussion that they thought they could have Medicaid matched there, and it did not pan out.
No,
Thus far.
thus far. All right, so now we're down to disability determination. We've closed that out. Administration support and Dale. That's the the offices. That's not programmatic.
That's not programmatic. That's.
So I think 330 would be the next one we want to look at, and that's the increase in wages for the personal care providers.
Is that what the House, Stephanie, is that the House changes are the increase in person?
I think it was to annualize the salary negotiated contract.
Yeah, it was not included in the governor's budget, but the agency realized it and provided a request.
Yeah, that's fine.
To fund that.
We did part of it in the budget adjustment, remember, for this year,
right,
because the increase kicked in.
So
331.
So is this where is this the section where the adult days are?
No,
No,
I
it's
I think actually there might be adult days in this.
in this?
The 5 million for adult days is in the one-time section.
yeah,
The baseline funding.
the baseline funding is here.
Yes,
Yeah, and it's in that $19 million grant line.
yes.
Okay.
I'll double check that, but the adult days aren't, a portion may be in the long-term care section, but I think there's also a portion in here in the grant lines, in the Dale grants.
Right, and that's the individual grants, and just for the committee's purposes.
Although
What?
some of the adult days, well, the global commitment, their global commitment with them. Yeah. Okay.
Yeah. So, but just for the
Anything
committee,
we're doing with adult days, well, first of all, when they did the 2% increase for choices for care,
Yep.
Where does that show up for the?
So
for the
we're going
adult
to scroll
days?
down a little bit further.
down.
So that's where the adult days are in a different section then.
So in section, it's in section 334.1. It's a little further down. That's the long-term care line that used to be in DIVA.
Right.
And so I do think I will double check. I think a small portion of the adult day funding flows through here, but I think the main funding is up in the grant line in Dale. So I'll get the split because I do
If
think
you would, I think we should be clear on that. Okay.
Yeah.
But the 5 million that the House did is in the one-time list.
Right.
Specifically for the adult days. That was
Specifically for the adult
Right.
days.
That's yeah. And so Rich and I've talked about that, but that's not here. So
That's not here in these
Do
sections.
you want to say anything about that here, or do you want
No,
me to
let's
wait?
hold it. But I think the bigger question is if part of the adult day and they gave a rate increase, is it how that fits if there's adult day in multiple sections?
I think they're in the analysis for the portion that would be rate, yes.
Because
Okay.
the bulk of the 2% increase they gave is in B133.
I know.
The 5.6 million that's down there.
I know.
And then the 1.9.
I know, but the question is if there's any of the adult day up in that first section under
Yep.
B330,
Yep.
how that fits relative to any rate increase, if there's adult day funding there and how much and for what.
I will double check that.
Okay.
It may have
All
all been on the long-term care side piece of it.
So we're
So-
gonna hold 330 then?
No, I wouldn't hold well, I 333, when we get down there, I think the question of do we give 2% or if we could find more money, would we give more? We should hold that. I think this any the biggest part of the increase to talk about adult days, the House did in one time. And on that list, and it was mostly about the startup cost because they consider that most of the adult days won't have the day they open, they won't have 50% of the their placements people come back. They're only counting on about half of the people coming back.
But the bigger question is for the long-term care 2%, where the adult days, which are Medicaid, are they split between different appropriations here?
Right.
So that's what we need to check out. And we're holding any of the 2% sort of off to the side for pending further discussion.
Yep.
334, that was again the 2%. That's for the TBI waiver.
Yep.
The same is true for 334.1.
Yep.
Okay, so now it's almost 3 o'clock and we're into corrections. Do you want to take a brief break until 3:15?
Sure.
People want to take a break until 3:15?
Yeah,
Are we-
that's fine.
How late are we going till?
4 o'clock.
Okay.
Or do you want to just keep chugging?
Break.
Whatever.
What?
It doesn't matter one way or the other to me. We got a meeting later tonight, right?
Yep.
But we'll still be done early.
Some of you have a meeting.
You have too, Richard.
Um,
Let's take